I'd like to invite Dr. Supriya DABIR. She's a consultant senior retina surgeon in Chennai, and she's been doing ROP work for more than 2 decades now. She's going to give us this very interesting talk on IVF modulation in ROP.
Good morning, everybody. I'd like to thank the Scientific Committee of APAO and AIOS for letting me present our data on how IVF modulates in ROP. So we know that ROP is a cause for preventable childhood, especially in the third world countries like India with a very high incidence. Mainly the reasons could be the increase in the number of neonatal intensive care units, the higher rates of preterm babies, the increased survival of these smaller babies, but lacking timely intervention in the form of screening, a lack of awareness among the pediatricians and the ophthalmologists, and the lack of access to trained ophthalmologists to do the same. So looking at infertility, according to the WHO, it has become very popular in the 21st century, and the incidence of the primary infertility rates are increasing more in the urban as compared to the rural population. Artificial reproduction techniques are defined as procedures that include in vitro handling of both human oocytes, the sperms or the embryos for the purpose of establishing a pregnancy. And the main techniques that are a part of ART are basically IVF, which is in vitro fertilization, IUI, which is intrauterine insemination, GIFT, which is the gamete intrafallopian transfer, and the ICSI, which is the intracytoplasmic sperm injection. Studies have proved that the use of IVF may lead to premature birth, and this could be because of the use of the autologous or the thawed oocyte, superovulated hormonal regimens, which could lead to disturbed endometrial maturation, increase in the maternal age, the different types of infertility, chromosomal anomalies, the epigenetic disorders, which causes abnormal methylation, cryopreservation. So these babies, apart from ROP, have an increased incidence in ocular comorbidities like the Coats disease, congenital cataract, glaucoma, colobomas, microphthalmus, retinoblastoma, etc. So the aim of our study was to basically establish whether IVF is associated with an increase in the incidence of ROP in these preterm babies at a tertiary eye center in south of India. It was a retrospective comparative study where the preterm babies were screened under the ROTAROP, which is a Rotary Assisted Retinopathy of Prematurity project, a multi-centric outreach project. We collected data between April 2019 to 21 of August. We looked at the babies who were screened were less than 34 weeks of gestational age and a birth weight of less than 2,000. They were screened 4 weeks postnatal age. When they were less than 28 or equal to 28 weeks of gestational age and the birth weight was less than 1,200 grams, we screened them much earlier. And if they were also screened if the babies had additional risk factors. We did an indirect ophthalmoscope, and the documentation was done using the Trinetra Neo camera from Forus. This is the project van where the camera is carried. These are the cards. Each baby is screened. Hospital is screened on a particular day of the week, and they're all given these blue cards like an immunization card where all the risk factors are noted here and the demographics are noted, and at each visit the findings are noted here. This is the sheet which is left at the center with the at the NICU, so that the neonatologist is also kept in the loop of things. This is our technician doing the photography. Intravitreal injections were given where needed. We used both bevacizumab as well as Lucentis and Razumab in the form of ranibizumab. Pre-injection, post-injection, these are the different images showing regression of the regression of the ridge, regression of the plus disease. And we mostly do a combination treatment also, where laser is done wherever the avascularization stops. On follow-up, these are the images showing the pre-laser and the post-laser data. So we had a total of spontaneous conception babies were 373, a total of 444 babies, where 373 were of spontaneous conception, and IVF babies were 71. We found significantly more twins and triplets in the IVF group. When we looked at the comparison of the risk factors between the different groups, we found that the neonatal risk factors were more in the spontaneously conceived. Basically, the respiratory distress, oxygen supplementation, the use of surfactant, transient tachypnea, and IUGR was seen more in the babies with who were spontaneously conceived. 99, that is about 22% of these babies had ROP, but we didn't see a statistically significant difference in the incidence of ROP between the two groups. However, there was an increase in the presence of ROP among the twins and the triplets as compared to the singletons. In the spontaneously conceived group, 2 babies had stage 4 ROP and another 2 had AROP, while none of the babies in the IVF group had ROP more than stage 3. Though the incidence of the higher stages of ROP, that is stage 3, 4 and AROP, were more in the normal conception group, the difference was not really statistically significant. So to conclude, there was no significant difference in the mean birth weight, gestational age of the between the two groups. There was a significant increase in ROP in babies of multiple pregnancies rather than singletons. And if you look at the incidence of ROP or the stages of ROP, it was almost similar in both the groups, but more severe ROP like AROP and more than stage 3 were found in the normal conception group, though this wasn't a significant difference. This could probably be because of the increased quality of preterm care and awareness of the risk factors, including oxygen supplementation among the neonatologists, and this could have contributed to the comparable incidence of ROP in our studies. There's, however, a meta-analysis done by Gao and group. They looked at about 219 studies and then zeroed in after they removed some of the papers because of references not being intact, or they were just basic researchers, conference abstracts. There were some who had were duplicated, insufficient material was recorded, and eventually they found 15 studies that they looked at, and there was significant association between the maternal ART use and ROP occurrence was seen in singletons. However, in multiples there was no significant association. The association between ART and stage 1 ROP was just at statistical border. Stage 2 didn't show any association, and stage 3 did show a significant result between association between ART and stage 3 ROP. Now, ART could show a significant association with ROP in the singleton group, basically contraindicating the notion that multiple births have a higher risk of ROP. This was attributed to the difference in the lower gestational age and the body weight of the singletons. However, ours was comparable gestational age and the body weight between the various babies of the two groups, the control as well as the IVF babies. Following IVF, Watson Adams reported a higher incidence of stage 3 ROP in the babies conceived by IVF. Chinovofa, and in their study, they show that ART may be a single independent risk factor, but in these babies, it could be a confounding factor because they have so many multiple risk factors, and hence it loses its significance about its contribution to ROP by indirectly influencing prematurity and the lower birth weight. Barker et al. Didn't show any significant difference either. This was IVF, but when you look at the rest of ART and its association, that is the other forms GIFT and IUI, the association between that and ROP was not really significant. This could be basically because IVF, most of the that forms the about 60% of ART, leaving the others as a very small percentage of the group, and this could bring a bias to the results. And also IVF requires many in vitro procedures, so these gametes of fused zygotes could have got harmed along the way. To summarize, with increasing adoption of ART and pro-prognosis of ROP, it is necessary to try and discover a relationship between these two aspects. It is worth noting that initially they would implant a lot more embryos, but now the number of embryos that are implanted are much lesser. So even singletons need to, even though it is a singleton delivery, the couples and the doctors need to take a risk of ROP occurrence into these babies, and a greater vigilance is required for screening these precious babies. However, maternal factors, the complexity of the ART treatment, different screening standards, they make specification of these individual factors really challenging. There are racial and genetic factors in the implementation, and there's not much data from the Indian subcontinent, and our study was one of the first to try and analyze this association. More randomized studies are required to find this association with the incidence of ROP. Thank you very much.
Thank you, Dr. Supriya. I think that's a very interesting association you brought out.